What is the Affordable Care Act's role in state healthcare exchanges? Have you ever wondered how the Affordable Care Act, often called the ACA, changed the way we access health insurance? Let's break it down and see how it all connects to state healthcare exchanges. The ACA fundamentally reshaped health insurance in the United States by creating state healthcare exchanges, which are also known as health insurance marketplaces. These exchanges are organized platforms where individuals and small businesses can shop for health insurance plans that meet specific standards set by the ACA. The main purpose of these exchanges is to create a competitive marketplace that makes health insurance more accessible and affordable. One of the key features of the ACA is that it requires insurance companies to offer policies to all applicants, regardless of any pre-existing conditions. This means that people cannot be denied coverage based on their health history. The only factors that can affect pricing are geographic location and age, which helps reduce discrimination in coverage. States had the option to either set up their own exchanges or let the federal government manage the marketplace for them. This choice has important implications for how healthcare is accessed at the state level. States that run their own exchanges can tailor them to meet local needs, which can improve outreach and enrollment efforts. On the other hand, states that relying on the federal exchange may have less flexibility in customizing their offerings. From a sociological viewpoint, the establishment of state healthcare exchanges highlights broader social and political dynamics. These exchanges address long-standing inequalities in healthcare access, particularly for low-income and marginalized groups. By providing a structured marketplace with subsidies and cost-sharing reductions, the ACA aims to tackle economic barriers that have historically excluded many from adequate health coverage. However, there are challenges as well. Some plans available through the exchanges have what are called narrow networks. This means they limit the number of doctors and hospitals that enrollees can choose from to keep premiums lower. This can create barriers to care, especially for vulnerable populations who may already have limited health care options. Additionally, the ACA's implementation through state exchanges interacts with other state-level decisions, like whether to expand Medicaid. States that chose to expand Medicaid have generally seen better improvements in coverage and access for low-income residents. In contrast, those that did not expand Medicaid leave a gap in coverage that the exchanges alone cannot fully address. In practical terms, the ACA's role in state healthcare exchanges has led to more people gaining health insurance coverage. It has also improved access to preventive and outpatient services, making healthcare more affordable for many Americans. These changes can influence social patterns by reducing financial stress related to health costs. People may feel less tied to their jobs for insurance, which can alter labor market behaviors. Overall, the ACA's creation of state healthcare exchanges represents a significant policy change in how health insurance is accessed and delivered in the United States. It illustrates the complex relationship between federal policy, state decisions, and social inequalities in health, showing how healthcare reform can be both a political and social process with wide-ranging effects on individuals and communities.